Hi, let's talk about perceptions and myths related to arthritis. Number one, the most common myth about arthritis is about the fact that arthritis happens only to people of a certain age, typically the 5th, 6th, and 7th decade. That is a myth because arthritis can affect people of any age, starting from the 2nd decade, extending up to the 7th decade. Myth number two, that arthritis is related only to wear and tear of the joint. And that is not true as well, because arthritis can happen because of a complex set of factors. The most common one, especially in India, is wear and tear that happens with age, but it can also happen because of varied things like infection. It can happen because of inflammatory responses in the body like rheumatoid arthritis. It can be because of metabolic factors like gout or hyperuricemia. It can be secondary to any injury that you sustain in your joint, wherein it is called as traumatic arthritis. So arthritis can happen because of varying set of factors and doesn't happen only because of wear and tear. Myth number three, you cannot do anything about arthritis. That again is not true. Arthritis can be managed, arthritis can be treated by doing several set of things, starting from medications, physical therapy, local ointments and local supportive therapy, and surgical management whenever it is required. Myth number four, patients with arthritis should not be involving themselves in physical activity or exercise. This is again a wrong perception. Patients with arthritis not only can, but they are also encouraged to involve themselves in a lot of physical activity and exercises. These exercises are advised with a lot of precautions, which patients are taught about. Typically, these exercises involve patients not doing a lot of high impact activities, but activities where their muscles are especially strengthened. Typical activities would be like swimming, stationary bicycling, yoga, and things where their muscle gets stronger while the joints are not loaded with a high amount of impact. Yes, patients with arthritis are advised not to involve themselves in sedentary life, but encouraged to involve themselves in physical activity with appropriate precaution. Myth number five, that arthritis affects only the large joints. The typical perception is that arthritis is something that happens to your large joints like your hip joint, your knee joint, and shoulder. The reality is that arthritis can affect any joint, starting from small joints of your hand, your wrist, your elbow, your hip joint, your ankle joint, the small joints of your foot, toes, and everything. So arthritis does happen to smaller joints, even though the incidence is less, but arthritis can affect any of your joints, starting from your spine to any other small joints of your hand.